Hey guys, this is Dr. K. So today we are going to be talking about interprofessional issues, specifically collaboration and collegiality. So first off, we're going to talk about communication. We all know that communication is important in taking care of our patients. We have to communicate with our providers. We have to communicate with other people from the interdisciplinary team. That can include pharmacy. It can include PT, OT, dietary, any and all of the above. So basically, communication is just the planning and delivery of patient care. It's the responsibility of multiple professionals. So, like I said, we all have to communicate to be able to deliver the best patient care. Cognitive, affective, and behavioral responses are used to convey a message to another individual. And so, in order to have effective communication, we have to be aware of things like verbal communications. That's going to include our words, our tone, our pace, clarity, timing, relevance, things like that. And then we also have to think about our nonverbal communication. So, what does our body language say? What does our facial expressions say? Touch, space, sound. All of those things involve nonverbal communication. Sometimes I know it's really difficult because I've definitely been there. When you're trying to talk to your provider and you're frustrated and you're trying to be cordial, but maybe your mouth is saying one thing, but your face is saying the other thing, they can tell. So we have to be kind of cognizant of what our face is saying at times too. I'm probably the worst about it, so I 4,000% understand if you also struggle with that. But it's all part of good communication. So collaboration, in 1992, the ANA essentially defined collaboration as the following definition that I'm fixing to say. So it is a means of a collegial working relationship with another healthcare provider in the provision of patient care. So, collaborative practice requires the discussion of a patient's diagnosis as well as the cooperation in the management of the delivery of care from everybody. So, each collaborator is available to the other essentially to be able to consult and communicate, but they may not need to be physically present at the time that things are like being communicated. Sometimes it's just a simple phone call and it's like, hey, what do you think about this? Or we're currently doing X, Y, and Z. Could we try blah, 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 because maybe X, Y, and Z currently aren't working. So that's essentially what this is saying. So we are working jointly with other healthcare professionals in a collegial manner to improve patient and client outcomes, and we have to be effective in our communication and collaboration. Also, collaboration implies an even distribution of power. It is non-hierarchical or hierarchical. Never say that word right. Essentially, what that means is that everyone's voice is heard and everybody is important because we are. Everybody has a place in the care team of the patient, and we are all there to make sure that the patient gets the best care possible. So everybody has a voice. Everybody's opinion matters, and we need to be respectful of each other. So, speaking of respect, collegiality. So, it is mutual respect and collaboration that is desired, is what this is. So, it involves sharing knowledge and skills and giving constructive feedback, improving and enhancing practices, and just overall contributing and supporting learning within the work environment. So, it's essentially sharing authority and responsibility to reach a prescribed goal or outcome. Benefits of interprofessional collaboration and collegiality are going to include higher levels of care coordination, better patient satisfaction, overall improved health outcomes, decreased in a cost of care, decreased in lengths of stay, patient involvement in decision making, and then improvement in work environment. Sorry, that's a typo there. It's supposed to say environment, not environment. So all of these things are gonna be a result of interprofessional collaboration and collegiality. Whenever we are working together, involving the patient or the family as we can, we're all going to be on the same page. We're all going to be more apt to agree on things more quickly because we're all trying to achieve the same goal. So ultimately, that's going to help get the patient better faster. It's going to help decrease the cost of care because we're not trying things that maybe just one person wants, but it may not be as effective as something else, especially if we have evidence to back that up. And then it's going to help, decrease those lengths of stays because if we're getting the patient better faster, we can get them hopefully home faster. Ineffective communication. So, research around failure to rescue began to highlight the issues with barriers that were related to ineffective communication. So, we all know that ineffective communication is or can be detrimental to patient care. Whenever we don't communicate effectively, there's a lot of miscommunication, there's a lot of frustration, there's a lot of I don't want to say anger, but to a degree, anger from patients, from family members, from you as a nurse, from a provider, another healthcare provider. It's not cohesive to the situation. So regulatory bodies have since set standards for communication. JACO published a guide in 2009 and then added separate safety goals in 2015. And I will link that in your additional resources so that you can take a look. Interventions and tools. The big one here that you guys are probably going to be familiar with is your SBAR. So, situation, background, assessment, recommendation. We all know that that is kind of like the thing that we do is like a handoff report. Like whenever we're leaving shift, we kind of do an SBAR. Like this is so and so. This is kind of what's been going on. This is how they currently are. This is kind of what we recommend going forward, what we think should continue, things like that. Personally, early warning systems, unless they've been called something different and I just can't think of off the top of my head what they may be called, I can't really speak to those. I haven't dealt a whole lot with those. And then rapid response teams are going to be your like your MRTs or your codes or things like that people call on the floors early to help prevent things from escalating. So when you hear rapid response or you hear MRT to room, blah blah blah, it's to get people down there and get the resources down there that is needed to help prevent things from escalating, potentially to a code or to something that's more detrimental. So, to err is human. So, medical errors can be defined as the failure of a planned action to be completed as intended or the use of a wrong plan to achieve an aim. So, among the problems that commonly occur during the course of providing healthcare, we have drug events and improper transfusions. We have surgical injuries and wrong surgical sites. We even have suicides, restraint related injuries or deaths, falls, burns, pressure ulcers. That's a big one. And then I've even seen patients' identities be mistaken. So, high error rates with serious consequences are most likely to occur in places like intensive care units, operating rooms, and emergency departments. And I want you to take a second and ask yourself, why do you think that is? Why do you think higher rates with serious consequences are most likely to occur in more critical areas? Well, I'm hoping that you said it's probably because the patients are more critical and one little small wrong thing could ultimately be detrimental. Not saying that it can't be on a med surg floor or in a clinic of some sort, but in situations like an ICU or an ER or an OR, those patients are typically already sicker than a snicker, as you know that I say all the time. Those are sicker than snicker patients. And one little minor thing could send them over the edge and catapult them into only God knows what. So they are going to be our higher rates with higher consequences. And then since this report has come out, the Institute of Medicine has actually called for healthcare professional educators to train future healthcare providers on how to work better with the interdisciplinary teams that would foster more collaborative interventions. So that's kind of the gist of this slide. Core competencies for interprofessional collaborative practice. So this is when multiple healthcare workers from different professional backgrounds work together with patients, families, the communities, basically anyone involved in the situation, to deliver the highest quality of care. So there are 4 competency domains for interprofessional collaborative practice, and these were developed in 2011. And they are values and ethics for interprofessional practice, roles and responsibilities, interprofessional communication, and teams and teamwork. So we can all see how those core competencies, those 4 things, values, ethics, roles, responsibilities, communication, and teamwork, essentially, are going to help us as professionals care for the patient better and provide a higher quality of care. So there's different statements for each of those 4 competencies. So the values and ethics statement is work with individuals of other professionals work with individuals of other professions to maintain a climate of mutual respect and shared values. And then we have one for roles and responsibilities, and it's use the knowledge of one's own role and those of other professions to appropriately access and address the healthcare needs of the patients and populations served. Next, we have our interprofessional communication statement. It's communication with patients, families, communities, and other health professionals in a responsive and responsible manner that supports a team approach to the maintenance of health and the treatment of disease. And lastly, our team and teamwork competency statement. Apply relationship building values and the principles of team dynamics to perform effectively in different team roles to plan and deliver patient or population centered care that is safe, timely, efficient, effective, and equitable. So I kind of hit on these at the very beginning of the PowerPoint. These are healthcare outcomes that are related to interprofessional collaboration, and it was found in a review from 2013. So for patient care, we're going to see improved diabetes care, improved emergency care patient satisfaction, reduced emergency care error rates, and improvement management of care in domestic violence cases. For professional practice, we see improved emergency care culture, increased collaborative team behavior in emergency settings and the operating room, and then improved mental health practitioner competencies in the delivery of care. So our collaborative practice models, these basically are just stating how we want to accomplish collaboration. So it begins with developing and organizing a collaborative team that consists of the different professions from the healthcare area. Anyone involved with the patient care should be involved or represented. So somebody from nursing, whether that's a charge nurse, primary nurse, the primary attending, PTOT, all of those. It requires administrative support to be successful, and it requires a dedicated technological structure. So, the WHO, or the World Health Organization, framework for action on interprofessional education and collaborative practice in 2010 demonstrates how to perform local health needs into improved health outcomes using IPE and collaborative practice. And I'll post a link for that as well so that you guys can see that. This is just a diagram of that WHO framework. And then actions to advance collaborative practice for improved health outcomes. So we're going to see structure processes that promote shared decision making, regular communication, and community involvement. Design a built environment that promotes, fosters, and extends interprofessional collaborative practice both within and across service agencies. Develop personnel policies that recognize and support collaborative practice and offers fair and equitable remuneration models. Develop a delivery model that allows adequate time and space for staff to focus on interprofessional collaboration, as well as the delivery of care. And then develop governance models that establish teamwork and shared responsibility for healthcare service delivery between team members as a normal practice. So, nurses as a collaborator and a team leader. So, the primary goal of nurses is to provide the best and highest quality of care to all of our patients, regardless of race, religion, ethnicity, gender, sexual orientation, or the ability to pay. There are many times when a nurse might assume the role of a team leader. So, nurses might be a team leader of providers to promote optimal individual patient and population health outcomes. And they might even be a team leader in patient care conferences or quality improvement activities. Specifically, with that, I think of like MDM that they do at NEA at 10 o'clock in the big conference room on each floor. The charge nurse and the nurse manager of the floor are both included in that, and they have a pretty big voice. If you've never sat in on one, I highly encourage you to go with your nurse because case workers are in there. A lot of the times, a physician may pop in, therapy's in there, and it's just a very good overview of how we collaborate as a team to provide the best care to our patients. Nurses, in their role as a coordinator of care, can often find themselves really in the best position to organize and lead a team of providers to promote that optimal individual patient and population health outcome. Because you, as a nurse, are with the patient 24/7. The doctor's not with the patient 24/7. The therapist, the nutritionist, they're not with the patient 24/7 like you are, day in and day out. So you can be that patient's biggest advocate for coordinating their care and helping provide the most optimal individualized care for that patient. I do want to say, so nurses must be able to negotiate, give and receive constructive criticism, conflict manage, and have excellent communication skills. So you've got to be able to negotiate to a degree, respectfully, need I might add, um, but there are definitely times where you're going to have to advocate for your patient, and it may come up in a conflict, but you've got to be able to manage that conflict with whoever it is, whether it be a provider, another nurse, a therapist. You've got to communicate really well, and then you've also got to be able to give and receive. Receive is the key word there, constructive criticism. So don't take constructive criticism as something that's bad. I personally think that there's always something new to learn, or always something that we can do better, or maybe we're not doing something as efficient as we could. And maybe someone else says, hey, instead of, maybe doing it this way, could we try this way? Don't take that as like a you're doing your job bad kind of thing. And by all means, if you feel like there's something that another profession, or not profession, but another team member is doing, like therapist or something, that isn't as effective or efficient, speak up. Say, hey, could we try this? Like, I know that this is what we've been doing, and we haven't seen just a ton of progress. Could we possibly try X, Y, and Z? So you can very much come from it with a respectful approach. And never let anybody be super disrespectful to you either, because we are, as I said before, a team. So teamwork is about respect. Teamwork makes the dream work. It's my motto. So respect one another. And if someone ever is being really hateful to you about something, and it's just like downright rude, just say, hey, look, this is, how we've been doing it, and I'm fully open to change, but I would like you to be respectful to me. Like, we're here as a team. So let's figure out how we can manage this a little bit better, and just take it from there. If you keep having problems, escalate to your charge nurse or your manager. But that's kind of my soapbox on that. Okay. Role conflict occurs when working in a team. Individuals can have different expectations and goals. I kind of just talked about this, so I'm not really going to go into more depth. Just kind of have to talk things out, but be respectful. With reducing conflict, obviously keep an open mind, be respectful, engage in trust. Trust that each other is trying to do what's best for your patient. Okay, we're obviously not going to be like, well, I don't care what you do. Like, no, we do care. Um, so you have to trust that the other provider is trying to do what's best for the patient as well, and come to a mutual decision. Explore barriers, discuss each other's beliefs and experiences. Maybe they're suggesting something based on a previous experience that they've had with another patient that worked really well. And maybe you've seen something work with another patient that you've had that they haven't. So just talk with each other, because experience is great, and it can help so much with future patients, especially if things work really well. And then engage in shared leadership. You're both a type of leader, or you're all a type of leader in interprofessional collaboration. We all have a leadership role to a degree, so just make sure that you're sharing those really or leadership responsibilities. And that is all I have today. So if you have any questions, just let me know.